Hello, today is Thursday, March 7th. Welcome to a new episode of Myofunctional Pathways, the podcast. So, today I want to talk specifically about how myofunctional therapy helps with snoring and sleep apnea. Okay, let's review what myofunctional therapy is. Essentially, it's an exercise program that is designed to strengthen muscles in your face, your neck, your throat, and your tongue. We really need these muscles to work well and to be strong and coordinated because these are the muscles that help us breathe, sleep, chew, talk, swallow. And we see some of these issues start very, very early in life, right? We all can see that baby or that child that has trouble eating or they're drooling. These are first signs of some sort of dysfunction that get more severe and more complicated as we grow and we get older. So what we do with myofunctional therapy is design a program specifically for you because every single kid, every single mom, dad, grandma, grandpa is going to have different goals. They're going to have different set of symptoms that they want to try to address. But most often, the thing that people can relate to and understand is sleep. We know that when we don't sleep well, we don't feel well, we don't function. We we don't have that energy. We don't want to go outside and play with our kids. Maybe our job performance starts slacking a little bit. So sleep is really the most impressive superpower that we have as human beings. What? Sleep? Superpower? What do you mean? Well, think about it, right? We need sleep for every single body system to function correctly. And we know that lack of sleep has a huge contribution to, snoring, diabetes, stroke, heart attack, high blood pressure, depression. There's so many things that lack of sleep stacks on itself. It stacks and stacks and stacks over a lifetime. And those things can start to impact our overall health. When we sleep well, we feel well. And when we feel well, we do things and we want to do things. And then that just makes our quality of life exponentially better. So let's talk a little bit about this. Okay, so let's talk about the tongue first. The tongue is 16 muscles. It's 8 pairs of muscles. And most people don't realize that the tongue is so many muscles. We just think of it as this big blob of steak in the middle of our face, right? Like it's like this big blob of meat, right, in our face, in our mouth. But it's a very, very complicated, very intricate structure that attaches to many other muscles in our face, in our neck, in our throat. And we need all of these muscles to be able to work together to be able to do things like chew and swallow and talk and breathe. But we also need these muscles to be able to work independently and do the specific jobs that they are intended to do. Okay. So yes, the tongue is 16 muscles, 8 pairs of muscles that its number one job is to keep your airway open. Now, yes, we need to breathe, or yeah, that's why we need our tongue. It needs to help us keep us alive, right? And it's not just about talking. Like talking is amazing. It's great that we can talk and communicate with people and have language and speak language is beautiful, but we don't need it to survive. We need to breathe to survive. So the number one job of our tongue is to protect our airways, to keep our airways safe. Think about your gag reflex. Your gag reflex is the body's automatic response to something threatening your airway. So if your body is perceiving that you are going to choke on something, your body goes into action, and guess what? You start gagging. In some people, this gag reflex is so severe that they can barely brush their teeth, or even just slight movements of their tongue creates a sensation that they're going to throw up or they're going to gag. This is the sensitive gag reflex to that degree is really something that's worth diving deeper into, especially with someone like myself, who is a myofunctional therapist, because I want to see what your airway health is like, what your muscle function is like, and what's happening in there to make your body think that you are going to die, that you are going to choke. And oftentimes we help people, I mean, they completely reverse their gag reflex. Now, it will never go away. And I don't ever want it to go away. It needs to be there. It is to keep you alive. So I don't want it to completely disappear. But I want you to be able to brush your teeth, and I want you to be able to go to your dentist appointments and take your x-rays and get your teeth cleaned without feeling like you're going to die. Okay. Because when you have such a severe gag reflex, that's really how people feel. They feel like this might make me die. This might kill me because I'm going to stop breathing or I'm going to choke. And it's a very real thing. So if this is something that you're struggling with, please reach out. So anyway, I'm digressing because I want to talk about sleep, but the tongue's job is to protect your airway. And then, of course, we need to be able to take in nourishment. We need to be able to breastfeed or bottle feed as infants, as babies. And then we need to be able to sustain nourishment as we grow. The tongue and the throat and the face and all the muscles, you have no idea how much work they do just to chew food and swallow it. So if you're someone who's having trouble with, chewing and swallowing, or you need lots and lots of water when you are eating, or you're very messy and you lose food out of your mouth, you can't keep your mouth closed when you're chewing. Look at it this way. We always, teach our children, we're taught to keep your mouth shut when you're chewing, right? But when they do that, it's not because they're trying to be disrespectful. They're not trying to be naughty. A lot of times it's because they can't breathe, and your body cannot breathe and chew and swallow all at the same time. So if you're having excessive messy eating, you're a very fast eater. Like say you take humongous bites of food, you put tons of food in your mouth, you chew it, chomp, chomp, chomp 3 times, and you swallow, and you're very fast and you're very messy. There's a high likelihood that you're having some difficulty with breathing through your nose, and your body is almost going into this fight or flight. In that moment when you're eating, it's like, okay, I need to get this food down as fast as I can so I can breathe again. And then this happens throughout the lifetime, and it just creates so much stress and anxiety on the body and fight or flight that, again, it just stacks on itself over years and years and years and years. Okay. So these are just examples of how complicated our oral facial muscles are, the muscles around and in our face, in our neck, and our tongue, and why they play such a big role. So now if you're having trouble chewing and swallowing and you're a messy fast eater, it's very likely that you're also probably experiencing some kind of sleep disturbances. Are you snoring? Is your mouth hanging wide open? Are you mouth breathing all night long? Snoring? Do you have sleep apnea? Do you wake up and feel like you didn't sleep? Are you like angry? I know I'm angry when I don't sleep enough. Like I literally am angry. I'm cranky. I'm mean. I lose my temper. I'm impatient. I'm all these things. So sleep is really, really important. And if we are having trouble coordinating our muscles when we are trying to do something like eat, then imagine what's happening at night when your body is sleeping and you're in that sedative or that sedation stage of sleeping. Your muscles are essentially paralyzed. So they're going to do whatever it is that they know how to do. And if they're not strong and they don't know how to keep the airway open and the tongue doesn't know how to stay out of your throat, then you're more likely to have some sort of sleep disordered breathing happening. And that could present itself in the form of snoring, restless sleep. You wake up and your bed is torn apart. You wake up on the wrong side of the bed, literally. If you're a child, maybe you're still wetting the bed or you're sucking your thumb. These are all red flags for some sort of sleep breathing disturbance happening at night. So what we do during the myofunctional therapy program is this is about, I don't know, 12 visits, 14 visits. It's going to depend on every person. This could be about 6 to 8 months worth of working together. And what we do is a series of exercises that I personally and specifically put together just for you. Because like I said, right in the beginning, you are completely different than your neighbor. You are completely different than your spouse or your child. You have different symptoms, you have different goals. And so I make your program completely unique and personalized to you. And that is your program. There's a lot of myofunctional programs out there that follow a script. Every single person gets the same exercises in the same order every single time. So find out about that. It's always good to question your providers, whether that's someone like myself, like a myofunctional therapist, or a doctor, or a dentist, or a chiropractor, or whoever it is you're working with. You want to ask them questions because you want to make sure that you're getting the highest level of care for the money that you are investing in yourself by obtaining these services. So ask questions. So in my practice, we will never have a cookie cutter approach. And I also incorporate sleep coaching that I have delved into, and functional breathing, because when you put all three of these things together, it gives the patient the best, most well-rounded and effective program. That's my opinion, okay? I don't have numbers or stats for that, but that's my opinion, because you need to have good breathing to have good sleep. And when you address the behavioral parts of sleep with the sleep coaching, it just makes sense. All of these things go together, they complement each other, and it's going to give you the best results. So make sure that your myofunctional therapist has done training from multiple different organizations, okay? It's important to have a large variety of training, in that you have the confidence in knowing that they have that experience and they have more than one course under their belt. Experience really does matter. It's important to know that myofunctional therapy is not just a set of exercises, okay? You can find stuff on the internet. You can find exercises to help your knee. You can help exercises to help you lose weight. I mean, you can help exercises because your shoulder hurts. You can find all these things on the internet. But just because you do an exercise and you follow an exercise that you find on the internet or a list of exercises does not mean you're going to get results, okay? You're not going to improve your knee unless you're working with a physical therapist who knows how those muscles are going to work to help your body. It's the same thing with myofunctional therapy. Sure, you can find some exercises online, but unless you're working with someone who understands the muscles, what they're doing, what the muscle physiology is like, what are the muscle fibers like, and how do they differ from the other muscles in your body? These are all important things that are going to ensure that you get results. Okay, so don't just depend on exercises you find off the internet. So do your research and find somebody who aligns with your values, has a lot of training and a lot of experience, is going to make a program specifically for you. Usually, so I mentioned a little while ago that a program may last 6 to 8 months, and that could entail 12 to 14 visits together. I kid you not when I say that oftentimes after our very first appointment, and that's a 2-week span, typically we meet every 2 weeks. But even in 2 weeks, people come back and they're like, is it too soon to already feel improvement? Is it too soon that I'm noticing these things with my tongue? And nothing gets me more excited than when someone tells me that, because no, it's not too soon. Okay, it's not too soon. The sooner, the better. These changes, they take time. You feel the effects of them pretty much every time you start doing them. So every time you start doing the exercises, the benefits of those stack pretty quickly. But the thing is that you have to keep doing them for them to become a new habit. We've all heard the term muscle memory, right? Well, in this field, that muscle memory is actually called neuromuscular re-education. So what the heck does that mean? Neuromuscular integration, that is your body is literally making new neurological pathways and connections from your brain, your nerves to your muscles, so that they are completely learning how to function and work in a new way. We want your therapy, your muscle function to become habitual, to become a habit. And that's what we're aiming towards. That's like one of the biggest end goals of myofunctional therapy. And the greatest thing about it is that you're going to be doing these exercises 3,000 or 4,000 times a day without even knowing it. So you're going to keep your airway muscles strong for the rest of your life. As long as you put in the work, you do the work, and those neurological integrations happen, you're going to be able to maintain your airway muscular strength for the rest of your life. And guess what? That means that you're probably going to sleep amazing. You're going to know how to sleep good. You're going to learn how to breathe. And why is breathing so important? And this is not like yoga breathing and these other kinds of breathing. This is functional breathing. So this is using the biochemistry, the science of your breath, the science of your breathing gases to work for you. And you can do all these breathing exercises all day long without anybody even know you're doing them. So it's meant to be stuff you do all day long, every day. Get a hold of me. I'm going to wrap this up, okay? Because I got a little bit off track. I wanted to talk mostly about sleep, and I threw some other stuff in there too. But really, I want you to have a good, well-rounded picture of what it is that we do here, why we do it, how it's going to help you, okay? And we did talk about those things, but let me wrap up by saying that you can reach us at myofunctionalpathways.com. We're on all the social medias. You can find us on Facebook, Instagram, TikTok, LinkedIn, Myofunctional Pathways. My name is Becca Rose. I am the owner and the sole practitioner. So you will always be working with me, at least at this point. At some point, I might need to bring on some associates to help me out. But right now, you're going to work directly with me. And I am personally taking care of every aspect of your care, creating your complete program, doing your therapy appointments with you, coordinating with other doctors that we might need to talk to along the way, and making sure that you are meeting all your goals and that your symptoms improve and your quality of life improves. So find us on our website, again, myofunctionalpathways.com. And on our website, there's a lot of information you can read. You can also request to have a free Zoom discovery call with me. So we'll hop on a Zoom for about a half an hour, talk about your symptoms, talk about myofunctional therapy and how we can help you. So reach out, get a hold of us. Let's talk about you. Let's get you sleeping better, feeling better. Sleep is your superpower.